from BSN 1 po, and today I'm going to perform the neck and vessel assessment. First is we have to wash our hands, then next is we have to gather all the materials that we're going to use during the procedure, such as the stethoscope, the pillow, and since that we don't have any pen light at home, we can actually use the flashlight, so this is the only one that we have. So, good morning sir, my name is Ryan Comfort, and I'm the center is going to assist the heart and neck vessel assessment. So today, the purpose of your heart and neck assessment po is we are going to know if you have some heart conditions or any disorder in your heart. So sir, you can contribute during the procedures po if you'll follow my instructions po, and if you're uncomfortable during the procedure, you can actually tell me po because it is also your right. So sir, do you have any heart condition po, such as heart attack?
No.
Heart surgery?
No.
Heart failure?
No.
So do you experience chest pain today?
No.
So if that's the case po, let's do the procedures po. So first we are going to do the neck assessment first. So the nurse would probably be in the right position of the patient, and the next we are going to do the supine position. Sir, would you please try to lay down po muna? So the level of the pillow should be up to 32 to 42 degrees to be able to inspect for the internal jugular vein of the patient. Next is we are going to ask the patient to turn its head to the left side slowly. Sir, would you please try to slowly turn your head to left po? So this is the internal jugular vein of the patient. Now we are going to use the pen light to be able to see clearly the internal jugular vein of the patient. So if the internal jugular vein is bulging or extended, it actually means that it is abnormal or the patient has a heart failure. And if it's flat, it actually means that the patient is normal. And now we're going to assist the patient to sit down. Sir, would you please try to sit down po? Now I'm going to palpate the carotid pulse for amplitude and elasticity. Palpate it slowly and one by one. Now I'm going to auscultate for roots using the stethoscope. First, I'm going to warm the diaphragm of the stethoscope. And then I'm going to starting from the left. Sir, would you please try to breathe po? Sir, would you please try to breathe po again? To be able to double check it, we are going to use the bell of the stethoscope. Sir, breathe po. Sir, breathe po. Now we are going to perform the heart assessment. First is we have to inspect for the visible pulsation and note the apical pulse or other. So this is the precordial. And now we're going to palpate for the apical pulse for location, size, strength, and duration of the pulsation. First is we are going to look for the second intercostal space. So this is the S2. And now we're going to palpate the abnormal pulsation or vibrations at the apex, left external borders, and base. And now we're going to auscultate for heart sounds, rate, and rhythm using the stethoscope. First is we are going to warm the diaphragm. And now we're going to auscultate for the S1 and S2 heart sounds for sound location, intensity, and duration. We are going to warm again the diaphragm of the stethoscope. So this is the aortic valve, the pulmonic valve, the tricuspid valve, and the myocardial valve. Now we're going to auscultate for extra heart sounds and murmurs. Sir, exhale po. Exhale po. So that is the sitting position of the patient. Now we are going to auscultate the extra heart sound and murmurs in left lateral position by asking the patient to lay down. Sir, would you please try to lay down po? Turn your body po sa left. Please move po. Sir, exhale po. Maintains proper body mechanics when performing procedures. And that would be the end of the heart and neck vessel assessment.